create jobs.
Join the Chamber and get the support your business needs.
All right, welcome back, everyone. We're joined by Dr. Rollins again. Today we're discussing antidepressant medicine, is that correct? And related to suicide rates.
Yeah,
some
thank you.
New knowledge on that, correct?
Thank you. Welcome, everyone. Yeah, there's a study came out today or just recently that showed that our thoughts about antidepressant medicines increasing the risk of suicide may not be actually as bad as we had thought. About 10 years ago, there were some studies that suggested antidepressants may actually increase one's suicide risk. And as it turns out, it really increased some suicidal thoughts, but it didn't really translate into actual suicides. So some of that data has been relooked at. Harvard Medical School study showing that there's not really an increased suicide risk associated with these medicines. And in fact, suicide rates actually went up a little bit in response to some of these studies 10 years ago because a lot of people didn't get treatment.
Interesting.
So I wanted to comment today a little bit on depression and anxiety and mental illnesses and just share some pearls that we deal with in the world of functional medicine. You know, we look at root causes for diseases instead of just looking at the symptoms. And for me, when I look at a patient with depression, anxiety, fatigue, insomnia, even autism and schizophrenia, those are changes in brain neurotransmitters. Those are changes in brain chemistry. The question is, what's causing them? And science is really confirming what a lot of us clinicians have thought for many years. Underlying hormone imbalances and underlying inflammation drive a lot of these changes.
Okay.
So what we do a lot of times is, of course, look at hormone imbalances like low thyroid or, you know, sex hormones that are low. A lot of men low on testosterone get diagnosed with depression, for example. A lot of women hit menopause, get diagnosed with anxiety and depression. People with low thyroid get diagnosed with depression. But a sneaker is inflammation, and a lot of times that comes back to the gut, believe it or not. Most of our immune system surrounds our gut.
Okay.
And so disturbances in gut function, like delayed food allergies or leaky gut, we often find are causing the symptoms of depression or anxiety.
Wow.
So I encourage people, if they have, you know, cases of illnesses such as depression or anxiety, that they consider there might be an underlying cause for these and take more of a functional medicine approach to see if they can tease that out. One other thing I'd like to point out, truth is, most studies on antidepressant medicines are so-so. They're not a whole lot better than placebo. I prescribe them sometimes, and I've seen them work well, so don't get me wrong. But statistically, in a lot of studies, they're not much better than placebo. Conversely, for many years, we've seen studies on regular exercise lowering the symptoms of depression 50%.
Wow.
Better than any medicine. So always keep that in mind.
Okay.
Thank you.
So you can heal yourself just by exercising.
Well, a lot of times. It's always worth considering.
All right, very good. Well, very interesting info from Dr. Rollins. If you have any questions for Dr. Rollins, feel free to call that number right there on your screen. We'll be right back.